Hello everyone, and welcome to our presentation about the California Assembly Bill 3087, or the Healthcare Price Relief Act, that our group chose as our signature assignment. You can find the bill at the following web address if you'd like to see the bill in its entirety. The author of this bill is Assemblyman Ash Kalra. He is a Democrat who presides over the 27th Assembly District, which includes downtown San Jose, East San Jose, Evergreen, and parts of South San Jose. Fun fact, he actually still lives in San Jose in the same neighborhood that he grew up in. He does have a law degree from Georgetown University, and although he has only been an assemblyman since November of 2016, he did spend 11 years as an attorney in Santa Clara Public Defender's Office. He is also the first Indian American that has ever been elected to the state legislature in California. A history behind our bill is this. Simply put, Americans spend more per person on medical and healthcare expenses than any other nation, even compared to those with similar gross domestic products or GDPs. We are actually really far ahead of the next nation. Healthcare prices being very high have resulted in nearly half of Americans putting off important medical visits when sick or injured, including procedures and tests. Some believe that the prices for medical procedures in California are arbitrary and completely unrelated to quality, and prices can vary significantly even between neighboring medical facilities. This rapidly increasing cost of healthcare is shrinking wages for workers, employers, and seniors, and is causing the inequality gap to widen. This bill, the California Assembly Bill 3087, also was created to help control the rising healthcare costs. Ash Kalra is quoted as saying, "We must act now before prices become unsustainable, not just for working families and their employers, but for our healthcare system overall." Some would argue that we're already to the point where we are unsustainable, and that this bill is really needed as a step to bring prices to a better place overall. This bill proposes that a 9-person board, which will be appointed by legislatures and the governor, would determine the cost of health care for doctor visits and hospital services and procedures. The board is called the Cost, Quality, and Equity Commission, and the main goal of this commission would be to determine what are fair prices for health care procedures, but also allow providers to adjust prices when necessary. This bill does use existing models, not only building off of Medicare reimbursement rates, but building off of other countries' universal health care programs that are out there. And these other rates were already set by previous California legislation, so some of the groundwork is already there. Public health and economic impacts. It does attempt to address the issue of high medical costs in the state of California. This involves an increase in the involvement of the government into the health sector, reduces the number of physicians and other healthcare workers, sets prices for medical procedures and treatments, and uses other methods of cost control to reduce total healthcare spending by the state. The idea is that if we reduce spending on subsidized public health from the government, they can then take that money and place it into other funded activities, such as schools and education, prisons, immigration, other areas where we definitely need more money and funds put into those programs. It does mean that the public would be responsible for paying more out-of-pocket expenses. However, the bill does allow for set prices to ensure affordability of the expenses and procedures. So we do have pros and cons with this bill, just like every single thing in life. Ultimately, the pro is that it would set prices for healthcare services, procedures, and treatments, which would end price variations regionally and locally. That means that in San Diego, you would pay the same price for a procedure as you would in San Jose or San Francisco. This bill is positioned for Californians to lead the change for all Americans as an opportunity to show how a single-payer system could work and illustrate the necessity of providing universal health care coverage to all. So this is a really, really well-positioned bill, a well-timed bill where people across the nation are really struggling with all of their medical coverages and increasing healthcare costs. Another pro of this is the use of tried and true Medicare system to ensure that prices are fair to consumers, doctors, hospitals, and other medical providers. Medicare is not without its faults, but it has been around for several decades, and it does, at some level, work to provide care, and not only care, but affordable care. And this could be an important measure of cost containment as it looks at the reasons behind all of these high costs and brings equity to the prices across the state. If this is effectively implemented, the lawmakers will eventually eliminate insurance companies as the middlemen for price setting and negotiations. Historically speaking, the insurance companies have been the ones to go and negotiate prices and what they're willing to cover and pay with these hospitals and doctors. And so this would now take that away from the insurance and it would become state mandated. On the con side, more money will be paid out of pocket from patients. Prices may initially rise for some or go down for others. The focus of the bill is solely on legislating lower prices. They do not use or look to use any other alternatives at all. There is some fear by some people that doctors and hospitals will respond to fixed prices by reducing the amount and level of care they are willing to provide, or simply shutting down or leaving the state altogether. Or it could be a possibility that hospitals would not be paid the same capital which they are used to, and that could lead to a reduction in staff or services offered. With the introduction of price gaps, gains from the field are bound to decrease, possibly reducing funds for development, as well as the capability of furthering treatment methods. So your research and development may not be as much as it was before. So our conclusion is that healthcare costs are out of control and they've only been rising for a very long time. The California bill AB 3087 attempts to address these issues through legislation of set prices and other cost-controlling methods. It does have significant public health and economic impact to patients, hospitals, healthcare workers, and the governments. And it could set a standard for nationwide legislation as far as universal coverage and set pricing. There are many pros and cons of the bill, and it may require constant monitoring and possibly further legislation to really make it work. Some questions that we do have for the class would be, would you vote for or against this bill and why? And do you see any other pros or cons to this bill, and what impact could those pros or cons have to the stakeholders? Our last two slides here are simply references. And that concludes our presentation. Thank you.